So if you see what are the different type of surgeries, so these surgeries are classified on the urgency, risk, and purpose. So these are the types of the surgeries. So this urgency, risk, and purpose. So what is the urgency one? So and also surgery based on the urgency. So this is going to be the elective surgery, urgent surgery, emergent surgery. And the urgency is divided into three parts, and there's three types of surgeries. So first one is the elective surgery. So this surgery is the procedure that is pre-planned and also based on the patient choice and also availability of the scheduling for the patients and also surgeon and also facilities. So this is like a planned one, pre-planned one. And also there's a patient choice and also availability of the scheduling for the patients as well as the surgeon and the facilities are available or not. So if anybody having problem or anything, if any delay of the surgery also, there is no ill effect. So this one is not an emergency one. So this is going to be the pre-planned one. It depends upon the choices and depends upon the availability of the patient as well as doctor. So these surgeries are going to be performed. So these elective surgeries are nothing but there are so many examples such as the hernia repair. So that is the extra like any displacement of the internal organs such as the in case of the abdominal hernia or inguinal hernia. So these are going to be like an elective one. So that means they are going to choose the time for the repair. So there is no emergency here. And also in case of another example is cataract extraction. So this also, if anybody having a cataract, so they have to plan when they want to also extract. So this also is another example for the elective surgery. Tonsillectomy. Tonsillectomy also is going to be who are having the the frequent tonsillitis or is so in those conditions, so doctors are going to the plan for to remove the tonsils for the to prevent the infections. So these are also elective surgeries. Hip prosthesis in case of hip arthroplasty. So in case of severe osteoarthritis or is there any avascular necrosis, in those conditions, if it is not emergency, if the patient are getting any discomfort during the walking time and also walking and also during the functional activities, so they have to change their hip with prosthesis. Also is artificial like a arthroscopic surgeries. So that is called as is a total replacement surgeries are also called as arthroplasties. So this maybe is a partial arthroplasty or is a full arthroplasty. If it is the hip as well as the acetabulum and also head of the femur, so they are going to change the full like a hip arthroplasty. And in case of the knee arthroplasty, then total knee replacement surgeries. So and also another type of surgeries are the urgent surgeries. So it must be done within a reasonably short time frame to preserve the health. So it should be within the time period. It should be done within the 22 hours to the 24 hours to the 48 hours. Within the 1 or 2 days, I will have to do the surgical procedures. So these surgical procedures examples are removal of the gallbladder. So if any obstruction in the gallbladder or any infection or any stone, so how to remove the gallbladder depends upon the infection of the severity of the infection or obstruction of the gallbladder. So how to remove the gallbladder. So within the 24 to 48 days. So this is an emergency and also otherwise they may chance to get the severe complications. And also such as the amputations in case of severe injury or crush injuries or maybe in case of like a electric shock or burns or any gangrene, severe necrosis and gangrene. So how to remove the limbs within the 24 hours to the 48 hours. So another important also is a surgical procedure is the appendicectomy. So in case of if any infection in the appendix or any inflammation, so in those conditions may chance to get the swelling and also may chance to if the infection is more, may chance to burst or maybe the infection may spread throughout the intestinal organs. So in those conditions, how to do the immediate surgical procedures to remove the appendix. So these are the example for this is urgent surgical procedures. And also another surgery is called as the emergency surgery. So this emergency surgery must be done immediately to preserve a life or body part or functions. So in case of control of the hemorrhage, in case of intracranial hemorrhage, if any bleeding inside the brain, so how to do the surgical procedure immediately. Otherwise, the bleeding because of the heavy bleeding, so the brain function is going to be decreased and also unable to do the functions. So it leads to the higher mental functions, and also the person may chance to get the stroke. If they are not doing surgical procedure immediately, so they may chance to get the permanent damage, permanent like disabilities. So that's the reasons how to do the like emergency surgeries to control the mortality and to prevent the mortality. Next one is repair of the trauma or perforated ulcers, intestinal obstruction. In case of any severe trauma or in case of like a road traffic accidents or any ulcers and severe ulcers and also intestinal obstructions, if any obstruction in the intestines, so it may give the serious complications. So in those conditions, have to do the emergency like a surgical procedures. And also other based like surgeries based on the degree of the risk. So what type of the degree of the risk? So these divided into major surgeries and also minor surgeries. What are the major surgeries? And we are going to be the major surgeries requires a hospitalization and also specialized care, is usually prolonged, has the higher degrees of the risk, involves the major body organs, are life-threatening situations, and has greater risk for the post-operative complications. So they may chance to get the risk factors and also may chance to get the so many infections and may gives the greater risk for the post-operative complications, such as post-operative complications, any like a hemorrhage, any infection, bleeding, and also may chance to get the any like a other stiffness, like this type of conditions may chance, and also embolus formation, thrombus formations, DVT, the deep vein thrombosis. So these complications may chance to get in case of the major surgeries. If it is major surgeries, this complication sometimes may lead to the like a until the mortality also may chance to get. So these are the great risk factors in case of the major surgeries. So what are the examples of the major surgeries? So these are going to be the open is a cholecystectomy. So that means the removal of the gallbladder. So in case of any gallbladder obstruction or maybe any stone, is there any severe infections or inflammations? So have to remove the gallbladder within the 24 hours to the 48 hours. And also nephrectomy. So it's a kidney surgery. The nephrectomy means the removal of the nephron. So this is going to be the major surgery. After that, they may chance to get the so many complications, may alter the like a blood pressure and also may alter the like a the excretory system functions. So in those conditions, they may chance to get the serious complications. Next is a major surgery is a hysterectomy. Hysterectomy means is a removal of the uterus. So in this guy, if any infection to the uterus or in case of any like a hormonal imbalance or may in case of any like a cancerous involvement to the uterus or any fibroids in the large amount, the big size fibroids also may chance to get the complication related to the like a uterus. So in those conditions, if the infections are not controllable, so if it is infected to the uterus part, may chance to the effect of other parts. In those conditions, so doctors will decide to remove the uterus. So that is the major surgery. So which is going to be remove the complete is a uterus removal. So this is also major surgery. And next one is the radical mastectomy. So radical mastectomy in case of the breast cancer, or is there any lump, is there any benign tumor, or maybe in case of malignant tumor. In case of malignant tumors, so have to remove the breast, and also that is depends upon the size of the cancer, depends upon the size of the lump, the breast is going to be removed. So that procedure is called as is a radical mastectomy. So including the axillary lymph nodes or including the lymph nodes removal also, so is part of the mastectomy. And also next one is going to be the next one is the laparotomy. So laparotomy is going to be the incision in the abdominal wall to diagnose any other complication in the abdominal and also intestinal organs. So it's going to be long, like a resection is going to detect any abnormality in the abdomen. So that is also major like a surgery procedures in the abdominal and also to diagnose any intestinal abnormality and also organs. And also if you see the minor surgeries, the minor surgeries is usually is a brief and carries the lower risk and also results in the only few complications. So they are going to get the very minimal risk and also only few complications may chance to get after the surgical procedures. So these are going to be such as like a teeth extract and also cataract extraction. So this is a very small, like a surgical procedure. So after the surgical procedure, immediately they have to go to the home. They no need to stay in the hospital, and also complications also very minimal. Only thing they may chance to get the minor infections or may chance to get the swelling. So the only these are the complications they will get. So no need to stay in the hospital. So that is the minor surgeries, and also the surgeries based on the purpose. Another classification is, so that depends upon the purpose also, the surgery procedures are different. So if you see that these purpose and the diagnostic purpose surgical procedures, ablative surgeries, palliative surgeries, reconstructive surgeries, transplantation surgeries, and also constructive surgeries. So we are going to discuss one by one here. So what are the diagnostic surgeries? What is the purpose of the diagnostic surgeries? So first one is the diagnostic surgeries. So these diagnostic surgeries is to make or confirm a diagnosis. So if you want, if somebody have some symptoms and signs and symptoms, if you want to confirm it, if the condition is to complete the diagnosis, so we have to do the some investigation procedures to identify the problems at the affected regions. So these surgical procedures are called as diagnostic procedures. So these examples of diagnostic procedures are biopsy, bronchoscopy, and also endoscopy. Biopsy, in case of if any suspect with any like a tumor or any injury or in in the tumor conditions, so we have to resect the small piece of the tissue through the surgical procedure. So if we send this small tissue into the pathological lab, histopathology lab, so we can easily diagnose are they having any complication related to the cancer or not, can find out and we can diagnose the conditions. So that is through the biopsy. The biopsy is the surgical like a excision of the tissues to send to the diagnostic purpose. So that is a small surgical procedure. So this surgery is called as the diagnostic surgery. And also another procedure is called as the bronchoscopy. So bronchoscopy is nothing but to send a small like a tube with a camera. So that is going to be investigate and detect any abnormality in our bronchus. So in the lungs, if any complications, in case of any bronchial injury or in case of carcinoma, so we are going to check the clear with a bronchoscopy. And also endoscopy. Endoscopy means if any gastric abnormality in the stomach, any abnormality, any gastric ulcers and any gastritis, any other complications. So we are going to diagnose we are going to find the problems with these investigation procedures. So these investigation procedures are also small surgical like procedures. So that's the reasons we call it the diagnostic surgeries. So another surgeries are the ablative surgeries. So this is going to be to remove a diseased body part. So in case of is appendicectomy or appendicitis, inflammation of the appendix, or if the inflammation, so may chance to get the spread to the other parts of the body because of the infections, or may use the the infection is spread, or if there is increasing the severity, the appendix is going to be burst, so it may use the infection spread to the overall the body. So that is the reasons have to remove. So it's going to remove the body parts, and also in case of amputations. So in the crush injuries, or maybe in the severe burns or necrosis, so and also gangrene conditions, so have to remove the limbs. Otherwise, it may affect to the other parts of the body. The gangrene may transfer to up in the proximal part. In those conditions, have to do the amputations or remove the surgical procedure. You have to remove the limbs through the surgical procedure. So that is called as amputations. So these surgical procedures are called as ablative surgeries. Next one is the palliative surgeries. So these palliative surgeries are to relieve or reduce the intensity of the illness. So it's not going to be a complete cure, so but it's going to be reduce the intensity and also illness. So in this condition, in these examples are the colostomy. So in the colostomy, if an abnormality, so they are going to be opening up the colon. So sometimes it's if infections, if in case of cancer, so they are going to opening so in the final stages of the illness, so they're unable to take the proper digestion or intake of the food. So those conditions, so they're going to opening the colon. So they're going to feed directly into the colon. So this is also one type of the surgical procedure to reduce the illness of the intensity of the illness. And also next one is the nerve root resections. In the nerve root resections, so in the fasciotomy or maybe in case of the selective posterior rhizotomy. So these are going to be if any nerve root involvement. So if any like a upper motor neuron lesions in those conditions, so they are going to be resect the nerve roots, or if any compression, if the nerve is compressed, so if it is not controllable the symptoms, so you have to remove the and also resect the nerve roots. So in case of the palliative surgery procedure, so that means it's not complete cure, but it is going to reduce the some symptoms with these treatment techniques. So these surgeries are called palliative surgeries. Next one is the reconstructive surgeries. So these surgeries are restore the functions to traumatized or also malfunction tissue to improve the self-concept. So these are going to be the scar revisions, plastic surgery, internal fixation of the fracture, and also breast reconstruction. For example, in case of any burns, so may chance to get the scar formations, may chance to get the like a keloid formation. The burn like a scar is going to become hard. So in those conditions, so if they want to improve the tissue function, so they have to like a scar excretion or maybe extract. So in those conditions, they are going to do the reconstructive surgeries. So in those conditions, they are going to take the some like a skin graft, and also they are going to remove the scar, and also with the plastic surgeries. So some reconstructive surgeries are going to be used to remove the scar or maybe to mobilize the scar. So that is the reconstructive surgeries. And also some plastic surgeries. So in the plastic surgeries, these days, nowadays, most of the people are they're taking the plastic surgeries to reconstruct the body parts. So for example, if the like a some lip enlargement, or maybe in case of the nose surgeries, in case of the nasal septum defects, so they are going for the like a plastic surgeries. So in these conditions, or in case of if nerve repair and nerve grafting, so if they are unable to do the normal movement, so they are going to reconstructing the surgeries, or maybe the cheeks are not sufficient, they're going to increasing the size of the cheeks and lip enlargement and also facial enlargement, or they are going to still they're going for the like a breast reconstruction, so breast augmentation techniques and also breast reduction techniques. So many different type of reconstructive surgeries. Who want to increasing the breast size, now they are increasing the breast size with some implants. So this also reconstructive, or who are already having the heavy breast, so they are going to also reconstruct and bring back to the normal size. So these are the some different type of the surgical procedures in the reconstructive surgeries. And also in case of internal fixation of the fractures. So for example, in case of the open fractures, so intramedullary nailing also going to do. So they're going to reconstruct the body parts, or maybe in case of missing components. So they are going to put the external fixators outside as well as internal fixator to stabilize the body structures with the surgical procedures. So these procedures, these surgical procedures are called as the reconstructive surgeries. So coming to the transplantation surgeries. So nowadays, most of the technology, so now we are doing almost all the organ transplantations. So because of the advanced technology. So these surgeries to replace the organs or structures that is diseased or malfunctions. So such as in case of kidney transplantation, liver transplantation, and also heart transplantations. So if a kidney damage, if it's not functioning properly, if any kidney failure, or maybe is any liver damage in case of cirrhosis, or maybe in any infections. So, and also in the liver heart transplantation, if the damage of the heart in those conditions, have to do the transplantation. If this transplantation also, so have to get the same like a all the the tissue should be matched properly, then only they can do the transplantation. If any like a mismatch, so it's not suitable, so the transplantation may fail. So this is depends upon the like a tissue matching only they are going to do this one. So but nowadays is the so easy like a, but before the three decades, so it's so difficult to do the like a transplantation surgeries. But nowadays the most of the all the organs are transplanting very easily with advanced technologies. So, but these are the major surgeries. They may chance to get the so many complications after done the surgical procedures. And also next one is the constructive surgeries. So these surgeries are restore the functions in the congenital anomalies. So these are the constructive one. If any abnormality during the development of the child, so may chance to get the these abnormal like a congenital abnormalities. So such as the cleft palate repair. Cleft palate repair means the cleft palate. So this going to be the lip is going to be like a open. The cleft palate is going to be open, not closed properly. So this type of abnormalities may chance to get in the like a kids. So during the development of in the uterus. So these are due to because of so many reasons. If any infection to the mother, or maybe it's the vitamin deficiency. So it may use the abnormalities such as the cleft palate or maybe spina bifida, and also other congenital abnormalities such as the atrial septal defect or ventricular septal defect, or congenital abnormalities such as the tetralogy of Fallot. So these are going to be like a constructive surgeries. So if they're having any abnormality during the development of the child, so these complications may chance to get. So these are the congenital abnormalities, or PDA, patent ductus arteriosus. So these are the some of the examples for the congenital heart diseases, or in case of is a congenital dislocation of the hip, or maybe in case of the CTEV, congenital talipes equinovarus. So depends upon the severity of the conditions. So these constructive surgeries will improve the like a normal function. It's going to be improve the congenital anomalies. So these are the different types of the surgical procedures.